So good afternoon. We're here today to provide an update on Phase 2. Secretary Sutters, her team, and the Medical Advisory Board have been reviewing the public health data this week. The critical pieces of data that we monitor, like hospitalizations, positive tests, and other measures, are all moving in the right direction, which means Phase 2 will begin on Monday, June 8th. This terrible virus and the terrible toll that it takes will be with us until there are medical breakthroughs with respect to treatments or vaccines. But thanks to your hard work and your sacrifices, we're bringing the fight to the virus and we're moving forward, and Massachusetts is continuing to reopen. With the help of the Reopening Advisory Board, which is led by Lieutenant Governor Polito and Economic Development Secretary Keneally, we've mapped out a gradual, phased-in plan to reopen our economy based on the public health data with measures in place to keep fighting the virus. In a world where COVID-19 exists, everything looks a little different. We're asking people to follow new safety protocols, to rethink the way they interact with customers, to stagger work schedules, and to work remotely. And so far, we're enormously grateful for everyone's support and creativity in adjusting their operations. This is on top of our request for people to keep their distance, wear face coverings, and do without several forms of gatherings and socializing since the middle of March. We've asked a lot of everybody here in the Commonwealth, every family, every business, every employer, every government agency, every individual to get to this point. But so far, we've made tremendous progress. We've been successful in bending the curve on COVID-19, and the metrics reflect that progress. Last month, we posted a dashboard that had key indicators on it, and yesterday, the COVID Command Center upgraded a third metric, the number of COVID-positive patients in Massachusetts hospitals, to green, or positive trend. Since the beginning of May, the 7-day average for positive COVID-19 tests is down 82%. The 3-day average of patients hospitalized is down 55%, and the number of hospitals operating in surge is down 76%. It's good to see these stats continue to drop, but we're also happy to see other stats moving in a different direction. We've conducted a total of 630,000 viral tests for COVID-19. We continue to increase the number of tests conducted per day and the number of testing stations available across the Commonwealth. And with our federal testing plan, we plan to significantly build on our testing and tracing infrastructure as we prepare to battle COVID in the months ahead. The start of Phase 2 is a bright spot for our Commonwealth. It marks progress and will hopefully breathe new life into our economy from more sectors like retail, restaurants, and lodging. We know the closures have been extraordinarily difficult. And as governor, these are in some respects some of the most challenging decisions I could ever imagine having to make. But thanks to the cooperation of so many, the trends have been moving in the right direction, and we're now able to reopen many of these businesses. You'll hear more about Phase 2 in a few minutes from the Lieutenant Governor and others. We're also expanding the list of outdoor recreation opportunities so that families can enjoy time outside of pools, playgrounds, and spray decks. As online learning winds down for K through 12, I'm both relieved and happy that our efforts to fight COVID-19 have resulted in this particular milestone today. Parents have been putting up with a lot for the past several months, and I hope Phase 2 will offer some different kinds of outlets for kids. Another important part of Phase 2 is the return of preventive healthcare services. For months, our healthcare providers, our hospitals, and doctors have pushed off annual exams and procedures like mammograms, colonoscopies, and heart screenings due to COVID-19. These important medical procedures are green-lighted in Phase 2. Our healthcare providers have done an incredible job of managing us through COVID-19. And they can safely and effectively manage other healthcare needs. And we urge our medical providers to reach out to your patients, particularly those with pre-existing conditions or vulnerable circumstances, and schedule those appointments soon. We are clearly on the path to beat the virus, but as I said earlier, until there are medical breakthroughs, we have to continue to take the fight and play our part in fighting the virus. COVID-19 is still very much with us, and it's incredibly contagious and in some cases merciless to those that are affected by it. And while we should all feel a certain sense of relief and progress with respect to the start of phase 2, we should also keep in mind that we have a way to go to get to what we would call a permanent new normal. Government, employers, and individuals, we all have jobs to do, and executing on these is the only way to continue to move forward. I know I've said this probably well north of a few hundred times since the middle of March, but please do your part to continue to socially distance, wear face coverings, practice good hygiene, stay home if you feel sick, because that all helps us keep moving Massachusetts in the right direction. At this point, I want to turn it over to the Lieutenant Governor so she can talk a little more about the reopening under phase 2.
Thank you, Governor, and good afternoon. As we look ahead to phase 2 on Monday and proceed through the reopening process, I would first like to thank the residents and businesses of Massachusetts for doing their part in fighting COVID-19. Your care and concern not only for your family and your fellow workers, but for others is truly appreciated. Governor Baker and I have been able to visit a few businesses across the state and witness firsthand the great work that so many have done to comply with the safety standards and the guidances, making workplaces safer for workers and for their customers. And in the process, they've demonstrated, as the governor said, creativity and innovation to adopt these protocols and really make the commitment to returning the workforce, doing business, and doing it in a safer way to reduce the spread. We are also grateful to our partners at the local level for working with us to support every city and town of our Commonwealth. To all the mayors, city managers, and town officials, we thank you. There are countless meetings and hours of planning and strategizing together, and I truly appreciate your level of leadership, and your commitment, your support, your cooperation, your collaboration. When we work together, we are at our very best. This pandemic has put a tremendous burden on our economy, and we know that people are very eager to get back to their normal routines. And as more places open, it's critical that everyone continues to do their part to fight COVID-19 so we can have a successful phase 2 and move forward into phase 3 and to the new normal. Secretary Keneally will talk a little bit more about the details of phase 2 and the staggered approach to the opening of businesses in phase 2. But as you start to get back into normal routines, which feels really good, and bring your kids to your youth sporting activities, to visit retail stores, and go to restaurants with friends and family, I just ask that you do what you can, and we've asked a lot of you, to support your local community and to support your businesses. Our Commonwealth is made up of terrific cities and towns. They're vibrant, they're beautiful, they're our homes. Our main streets and downtowns have looked very different in these past couple of months. But as we reopen and we restart our economy, it is important that we continue to build strong communities. And buying local, support local, visit local are all things that we can incorporate into our new activities in the upcoming weeks and months. When you buy from the local and small businesses that make up the fabric of your community, you support our Massachusetts economy. You may decide to enjoy outdoor dining or visit a local or family-owned restaurant in your neighborhood, one of your favorites. I've heard great stories from municipal officials, but also restaurant owners who are being really creative about opening areas to dine on sidewalks and in streets and parking lots. Make sure you visit and enjoy some of that experience. I think it'll be a lot of fun for all of us. Go to the corner stores and shops in your town centers. They need you. Since the fight began, people across our state have done their part to fight the virus spread, and we must continue to do so, and we must focus on economic recovery. The full list of businesses that can reopen and the guidances associated with how to reopen safely can be found at mass.gov/reopening. Once again, I want to thank the workers and employers and businesses and residents all across our great state who have made significant sacrifices to support our fight against COVID-19. As we reopen, we know that we can count on you, that we'll continue to partner with you, and together we will continue to fight the spread and help our economy recover, rebound, and grow in our Commonwealth. I'd now like to just extend my appreciation to Secretary Keneally and to Commissioner Burrell, the co-chairs of the Reopening Board, and to the Reopening Board members for working so hard on this process. For your team at HED, they're tireless. It's just a great group, and it's been a real honor to be able to work with you, Secretary Keneally.
Great. Thank you, Lieutenant Governor. I'll say as well, it's been such an honor to work with you on this. It's been an incredible team effort with our teams, and thank you, and thank you to Commissioner Burrell and her team as well. You know, we started this reopening process with many businesses shuttered and services paused, and we asked employers and workers to make sacrifices, and we knew that the road to reopening could be long and difficult. But thanks to the cooperation of the public, businesses, and workers in fighting COVID-19, we've seen strong improvements in key public health metrics. This gives us the confidence to take the next step in our 4-phase reopening plan as we move towards a new normal. Now, when phase 1 starts on Monday, it will proceed in 2 steps. Guys, sorry, phase 2. Darn it, when phase 2 starts on Monday, it will proceed in 2 steps. Step 1, let's focus on the 1 there. Step 1 will begin on Monday, June 8th, and will allow for the reopening of places like retail stores, childcare, day camps, lodging, youth sports, and outdoor seated dining at restaurants. Step 2 in phase 2, the start of which will be determined based on continued improvements in public health metrics, will allow restaurants to serve guests indoors. Close contact personal services like nail salons, massage therapy, and tanning salons will also open in step 2. And similar to phase 1 of reopening, in phase 2, we will have 3 levels of safety guidance for residents, businesses, and workers. And those are general social guidance, mandatory workplace safety standards, and sector-specific safety protocols. Now, earlier this week, we published protocols for retailers, restaurants, and lodging. The Executive Office of Energy and Environmental Affairs also released protocols for recreational activities like pools, beaches, and outdoor sports. And today we released protocols on close contact personal services, as well as protocols for what we're calling sectors not otherwise addressed. Kind of struggle with the name on that one, but these are businesses with unique operations that don't really fit neatly into other categories. Similar to phase 1, before phase 2 businesses may reopen, they must meet all safety standards, create a COVID-19 control plan, and complete a self-certification. And if you're a business owner, an employee, a customer, or a concerned citizen, you can view all of these protocols and resources at mass.gov reopening. And if everyone commits to adopting standards that will reduce the transmission of COVID-19, we'll continue along this positive track and build on the momentum we've created so far. And this means adding jobs, ramping up research and development, increasing innovation and emerging technologies, and continuing the work we've all done over so many years to make Massachusetts a beacon of economic success. Thank you, and I'd now like to turn the podium over to Secretary Sudders.
Governor Baker, Lieutenant Governor, Secretary Keneally, Commissioner Burrell. Good afternoon, everyone. Our healthcare system has responded throughout the pandemic surge to meet the emergency and urgent healthcare needs of our residents. Our healthcare providers responded as a system, from the largest academic medical centers to safety net hospitals to community health centers. We are grateful for all the work they've done over these past few months. Innovation and collaboration included quickly standing up 5 alternative medical sites and the Newton Pavilion in preparation for the surge. They were located in Worcester, Lowell, the South Coast, on the Cape, and in Boston. After caring for 723 patients since its opening on April 10th, Boston Hope discharged its last patients earlier in the week. The 1,000-bed facility will remain in place for the time being in the event of a second wave. And yesterday, the Newton Pavilion, a partnership between the Commonwealth, the city, Boston Medical Center, and Healthcare for the Homeless, ceased its operations when the last person transitioned to another setting. As we move cautiously into phase 2 of the Commonwealth's reopening plan, we are allowing more in-person, elective, non-urgent healthcare treatment and procedures. These procedures include routine office visits, dental visits, and vision care, subject to ongoing public health compliance. They include in-person behavioral health treatment. We continue to emphasize the importance and utility of telehealth to the greatest extent possible as appropriate and feasible. Healthcare providers should expand in-person services cautiously, using clinical judgment to prioritize urgent services, high-risk patients, chronic disease management, and preventive care. Prioritization criteria should promote equitable access to care, particularly for vulnerable populations. Hospitals continue to be required to meet the requirement of having at least 20% inpatient capacity available. Additionally, we are advising that healthcare providers delay or defer certain non-urgent services that require resources and hospital space that still needs to be preserved for COVID-19 patients. Elective cosmetic procedures and surgeries and in-person day programs will be deferred to phase 3 of the reopening plan. Information, including the attestation documents, are posted online at mass.gov/HHS reopening. As you all know, in March, visitor restrictions were put into place at healthcare and human services organizations across the Commonwealth. We understood and understand how difficult this has been for loved ones and companions. There were exceptions, of course, for hospitals and nursing facilities for compassionate end-of-life visits, but there were many restrictions. Going forward, effective June 10th, hospitals may allow 1 visitor at a time per patient, and someone may accompany a patient for an ambulatory appointment at any healthcare setting, subject to symptom screenings and face coverings. For other health and human services programs, again with limitations, we have specific timetables. Our soldiers' homes will begin limited outdoor visitation on June 15th, as long as infection rates remain stable. Human services adult residential programs and group homes can resume limited outdoor visitation on June 10th. And human services children and youth residential programs can resume outdoor visitation on or before June 30th. We're working with the provider community to implement best practices and protocols over the next few weeks that prioritize the safety and security of all children in these programs, while ensuring they're able to visit with their families and loved ones. As we near these respective implementation dates, each congregate care program will be reaching out to families and guardians to schedule visits. Again, details on these policies can be found on the mass.gov/HHS reopening. As we begin to move into phase 2, it remains critical that all of us continue to follow all of the public health guidance. Wash your hands, wear a mask or face covering in public, practice social distancing protocols. Thank you. Governor?
Questions on this stuff?
As you mentioned progress in your opening remarks about phase 2. Well, on June 1st, Massachusetts is the only place in the world that doesn't allow you to go to a driving range and do golf balls.
We've been very successful over the course of the past 120 days in significantly reducing the amount of COVID we had here in the Commonwealth, and we did that by following the guidance and the advice from our colleagues in the public health and the medical community. The entire reopening strategy was done in conjunction with the medical community and the folks in the public health sphere, and we're going to continue a phased implementation of a reopening because we believe that's the best way to ensure that as we move forward here, we can sustain our reopening. The thing we should all be most concerned about at this point, and I know everybody is in a hurry to get to where they want to go with respect to reopening, is that a phased reopening based on guidance from the folks in the healthcare and public health community is the process through which we are most likely to be able to sustain our reopening. Remember, the whole point behind putting a tracing program in place to support an enhanced testing regimen was to make sure that as we reopened, we would be able to more quickly identify those who tested positive, to help them isolate and to support them and to get in touch with whomever might be their close contacts to ensure that we could isolate and support those folks as well. This is a difficult process for everybody, and there's not a day that doesn't go by that the Lieutenant Governor and I don't hear from somebody who thinks they should be in phase 2, they should have been in phase 1. I've had several people actually tell me they didn't want to be in phase 1, would have preferred to have been later. But the bottom line here is we're going to follow the guidance and the advice we get from the folks in public health and accept the fact that that's going to make this process on a particular subject matter basis difficult, but recognize and understand that the goal here is as we move this thing forward to be able to sustain it so that we don't have to go back a step at some point in August or September.
So if I'm going to, the folks in the phase 2, step 2, if they had their guidelines ready for Monday, would those folks in phase 2 be able to move forward? And I'm specifically, let's say, like a hair or nail salon.
Well, the hair salon's already open.
Nail salon.
They're going to open at what we're calling sort of the step 2 in phase 2, and that's going to be determined by the data, which will probably be revealed over the course of the next several days.
Governor, with more of these businesses opening with restrictions, it puts more pressure for enforcement at the local level. Are you concerned about that? Is there anything additionally the state is going to do to support that?
Well, we've spent a tremendous amount of time with our colleagues in local government on all the rules associated with both the statewide protocols and the industry-specific protocols, and have adjusted them based on feedback we've gotten from locals about what's possible and what's not with respect to enforcement and oversight. And in a number of instances, we have significantly enhanced resources, particularly in the area of the boards of health, to make it possible for them to do more.
I apologize. In the past, I know you've talked about knowing when you started this phase plan that it was going to be painful for a lot of businesses. Some of them will never return. But in terms of the medical side of it, we know there's more procedures available, routine exams. What about the people who still won't be in this phase, who've been waiting for months for things that have gotten worse?
I was all the way there. I didn't hear the last part of that.
People who have been waiting for months but still won't be part of this next phase, and they're still going to be in phase 3 or 4. They're going to have to put off things even longer.
I think at this point, all that's left is day programs and cosmetic surgery.
Those are the only things.
Yeah. I mean, the reason we frame this around encouraging providers to do outreach to those folks that they believe, based on their knowledge and understanding about their patients' circumstances and situations, that they reach out and call them, is so that there's an orderly and a strategic approach to actually bringing people in to start taking care of that stuff. Our view is the provider community is probably in a better place to understand and appreciate where the people that they take care of are at a given point in time with respect to whatever their healthcare situation is. And that's the other reason why we keep talking about telehealth, because telehealth in some respects is the fastest, quickest, easiest way for people who want to connect with their providers and then follow up on whatever comes out of that original consult with respect to their healthcare generally. But our view at this point is phase 2 opens pretty much everything except the day programming and the... Do you want to speak to this? You look like you do.
as we all know, everything takes longer. And so ambulatories, if you have your doctor's offices, hospitals, if you've gone to a hospital, waiting rooms and the like, right? We all have, there's fewer chairs in a waiting room and the like. So it will take longer for patient visits to occur because we need to have social distancing in place, appointments will be more, not scattered, but scheduled with distance in between them. Staggered is the word I wanted, staggered. And so what we want healthcare providers to do is to reach out to those individuals in their patient profiles, in their panels, who they know are more vulnerable, who have underlying medical conditions. And when we say prioritize them first over someone perhaps who's just needs to get their annual physical exam who doesn't have any underlying medical condition. So that's the message to providers, but essentially other than cosmetic surgery and day treatment programs and the like, everything is now open.
Governor, looking back over phase 1, did that go exactly as you had anticipated? Were there any surprises, any disappointments, and any lessons to learn as you go into?
I think first of all, I think the phased approach has demonstrated that it's the appropriate way to go because we've continued to see positive developments with respect to the key measures that we laid out at the start of this process. I would say that the two biggest things that I've taken away, and I would actually like the LG to comment on this too. Number one, if people were working remotely and they had the ability to go back to the office, most people seem to have continued to work remotely. And I think that's that one over time is going to be a really interesting dynamic because I think in many ways there are a lot of good reasons for people to continue to work remotely if they can make it work. And I think a lot of us didn't know what people would choose to do once they had the opportunity to just quote unquote go back to the office. I think the second thing is because our data continued to get better, it's pretty clear that the choices we made with respect to what we chose to open under phase 1 were in many cases the right kinds of things with respect to their ability to comply. And I'd like the LG to talk a little bit about the local government thing because that's an important part of this, but it seems to me like we have not heard that local governments are feeling overly burdened by the responsibilities that they've been taken on as a result of this.
I think the preparation that we've been able to do along with municipalities and with businesses before their opening has helped a lot. The one thing that the Secretary and I and our reopening board spent a lot of time on, which was time well spent, was listening to the industries around how they could make their workplace safer. And so that informed the ability to create industry protocols with checklists and posters and really spell out how you in this industry can transform your workplace. And that has rolled out pretty smoothly with the support from municipals who were briefed in part of the process well in advance, as well as having the Division of Labor Standards available for technical assistance. So while that was one key piece that before opening, here's what you need to do so that when the date for opening comes, you're ready. Now, the other point as to why that's really important is because we need to build confidence among the workforce and as well as the public. That for a worker to now go back to a workplace, that they feel confident and comfortable that their employer has incorporated these safety features into the workplace. That's important for the worker, the co-worker, and for when that worker returns home, so that they feel that those safety measures have been adhered to. And the other is the confidence of the consumer and the public to feel that when they get back into a rhythm of doing more, that they know that there is a self-attestation process, but there's a poster, and that there is an affirmation that that place has done the necessary things to make it safer. And then the third part is just the individuals are far more, across the Commonwealth and the country, far more informed about how to make it safer for yourself. I mean, the hygiene and the hand washing and the face coverings and the distancing, that has just become part of our day-to-day life, and it's the standard and expectation that people have now as they move out and about. I would say the trickiest part, and the Secretary would agree, is the choosing with the public health guidance how to phase. And that was one thing we learned from phase one, that some wanted to be incorporated sooner and some were okay with where they're at. And I think it will be interesting to see now how businesses respond now that they're eligible to open. You know, when will they actually open in phase two, and what will the public's response be? So we will clearly measure that, and we will be working on the businesses that are in phase three and helping them start to prepare for their opening when that day comes.
Governor, as the state has been reopening, traffic has increased significantly and it will continue to do so. Any plans to reopen the HOV lane, and if so, how do you reconcile the need to social distance with encouraging carpooling?
So carpooling obviously is a decision people need to make on their own. Most of the carpooling that's happened over the course of the past couple of months has almost all been families. And families can carpool. That's really not an issue. I think the HOV lane opens on Monday, doesn't it? Yeah, the HOV lane opens on Monday.
All right, so last question.
Governor,
Governor, as we look at people
what
gather-
are your concerns about phase two, step two, and moving forward as we have all these kids, adults, older folks, all there's more demonstrations tomorrow? How will this affect phase two and phase three moving forward?
Well, we said before that anytime you put a lot of people together in a particular space, indoors or outdoors, the potential for spread is real. Much less so outdoors than it is indoors, but it's still there. And we've urged people to wear face coverings if they're going to participate in those demonstrations. And I will say that many communities have been handing out face coverings to people as they gather to march, which is terrific. And the vast majority of the people, at least in the ones that we've been sort of particularly close to, have been wearing face coverings. And I think in many ways they're moving, which also helps. But we're going to have to wait and see what comes through in the data. And this is a real balancing act. I think there were 40 events last night of one kind or another that we were involved in with our colleagues in local government. And they ranged in size from 50 to 100 up to over 1,000. And again, they're outdoors. Most of the people were wearing face coverings, and they were moving. And those are all really good things. But you put big groups like that together, and it certainly enhances the risk. Yeah.
I know you're looking at all the data points as you have been throughout the entire. As we move forward, is there any one or two particular data points that would be like a canary in the coal mine that we might be having a problem that you're really keeping an eye on?
Well, obviously, the percent of positive tests is probably the thing we pay the most attention to with respect to that issue. It's one of the reasons why we've continued to expand our testing capacity, and it's why we're in the process of adding testing capacity in a lot of places where we don't have it. I mean, we're now getting to the point where, what do we have, 250 testing sites around the Commonwealth? And so we're trying to make sure that we have testing sites as we add them in the places where we don't have them, so that we have fairly broad testing capability anywhere in Massachusetts. That's certainly one of the big measures. And as we've said before, the whole issue around how many people are in a hospital because of COVID and how many people are in the ICUs because of COVID is a really important measure, because if we have totals in the ICU and in the hospitals generally when they are sort of staffed at their licensed rate, and we can manage that, and they can manage that, that means that a lot of the other stuff that you were talking about with respect to healthcare actually happens, and we don't have to worry about getting into a situation where COVID overwhelms the healthcare system. But I think in many ways, the reason we have those 6 benchmarks, which almost all have to do with testing and hospitalizations and ICUs and capacity to serve, is because we really do believe those are the ones that we need to spend the most time thinking about and worrying about.
Governor, a federal court threw out the Weymouth compressor station air permit, ordered the administration to reconduct the test there. Are you going to do that? How do you feel about that court order?
Well, first of all, the court order basically rejected almost all of the accusations that were made with respect to all of the issues that were raised by the locals. What they focused on in particular was whether or not there had been adequate work done to determine if there should be a substation there in addition to the compressor. We're currently reviewing the decision, and we'll make a decision on how to go forward sometime soon.
Gathering sizes for...
Say again?
For gathering sizes, for people planning, say, small weddings or just wanting to get together with friends they haven't seen in a long time, what's the guidance there at this point, phase 2?
Well, I guess what I would say is that the gathering stuff overall really is focused on confined spaces, right? Indoors especially. On outdoors, I think for the most part what we would say is people should be responsible and respectful with regard to the virus. I got asked this question before Memorial Day weekend, and I said, if you want to have a cookout in your backyard and you want to have a few friends over, be smart about it and recognize and understand that distancing is a good thing, hygiene is a good thing, and face coverings are a good thing. And I think that would be my recommendation with respect to those sorts of things as well. People need to just recognize and understand that outdoors is always going to be better than indoors. But when it comes to gathering generally, people should be careful about what they do and how they set that up.
Will you be taking your wife out to dinner this week?
Pardon me?
Will you be taking your wife out to dinner this week, this coming week?
Maybe. We'll see what happens. I managed to get to go see my dad, which was a big deal.
I noticed that
He needs a haircut, but other than that, he's fine.
speaking of being indoors, I noticed that none of you has a mask. Is there a reason for that? Did you specifically decide not to wear them for any reason, or why aren't you wearing masks?
Well, the main reason we're not wearing one is because we're distanced, and the second one is we've been told by a number of folks that while this is enormously helpful with respect to people who have issues with respect to hearing, being able to translate what we're saying, we've also been told they really want to be able to read our lips, and I understand that.
One more question, thank you. Last week was an incredibly busy week to be governor of Massachusetts, and that included a lawsuit filed against you challenging your authority about the shutdown by mass discipline and others. So what is your next step regarding that lawsuit?
Normally, we don't really speak to lawsuits when they're in process. Obviously, we're aware of the fact that it was filed. When people issue decisions, we usually comment on that, but I don't usually comment on pending litigation. Thanks, folks. And I appreciate you coming in on a Saturday.